Hi everyone, my name is Elizabeth Orum, and I did my research paper on the effects of the aging population on the United States healthcare system. So I'll start off with the introduction. So it's first vital to understand why this topic is important. So having an efficient, affordable healthcare system is a requirement for a sound economy and society. There's a lot of different factors that can affect a healthcare system, but currently in the United States, the most critical is the effect of the aging population. So as we all have been learning throughout this course, as the baby boomers are aging, it's leading to an increase in the average age in the United States, and this is what this graph is showing. The elderly population is growing rapidly and also increasing longevity. So understanding how the aging population will affect the healthcare system will benefit everyone, especially physicians and patients. So to understand the effects of the aging population, we first have to go over the key elements of how older adults use healthcare services, such as physician and hospital visits, common diseases, and disparities among racial and gender groups. So once we understand how older adults are using the healthcare system, it will be clear that the aging population will demand more healthcare providers and increase overall costs. However, there are multiple remedies, including expansion of self-care and technology use, that can help reduce these costs. So we'll head into the body. So first we want to go over how older adults use the healthcare system. So generally, older adults are using healthcare services much more than younger adults. And this is greatly due to an increase in chronic conditions and a natural decline of the human body. So as you get older, we all know your body begins to age and you get more illness and injury. So it's leading to older adults using healthcare services a lot more than younger adults. Older adults visit physicians much more than younger adults, and also older adults visit specialists much more than younger adults. And especially older adults visit cardiologists and neurologists more. And this is again due to the fact that many older adults have at least one chronic condition and the natural decline of the human body. So older adults also visit the emergency room more than younger people. And according to Centers for Disease Control and Prevention, in 2017, the emergency room visit rate for adults aged 65 and over was 12% for injury, which you can see on the left bar graph in the dark blue, and 36% for illness, which is on the right bar graph in the dark blue. And also, within that range of older adults, people in the age group 85 and over had the highest visit rates in both illness and injury. So emergency room visits increase within older adult age groups as well. The Center for Disease Control and Prevention also did a research that found patients 65 years and older make up almost 40% of hospitalized stays and even accounted for nearly half of all healthcare money spent on hospitalization. So there's clearly a significant increase in all of these areas, physician, specialist, and hospital visits, as people age. So it's really vital to understand the common conditions and diseases that are causing this increase to improve the healthcare system overall. So one of the major reasons for the increase in the use of the healthcare system is chronic disease. And as you can see in this graph, around 80% of people ages 65 and older suffer from at least one chronic condition. And that's shown on the right column in the dark blue. And then you can also see in the orange in the same column that around 60% of people aged 65 or older suffer from 2 or more chronic conditions. And the four of the most common chronic conditions are heart disease, cancer, stroke, and diabetes, which all of those together lead to almost 2/3 of all deaths in just 1 year. And heart disease is the leading killer of older adults, which accounts for over 480,000 deaths in 2014. Fortunately, though, there are lifestyle changes that can greatly decrease the risk of developing heart disease, such as eating healthy foods, exercising, and sleeping well. Chronic disease can be kind of difficult to treat with medication because there's a risk of over-medicating. However, many physicians will still attempt to treat chronic disease with a more holistic approach, and a really popular one that was developed by the Stanford School of Medicine is called Chronic Disease Self-Management Education. And this is where patients can learn how to cope with frustration, fatigue, and pain, while also improving strength and flexibility. They learn the tools how to communicate with family and friends about their chronic disease better. They learn how to improve their lifestyle by learning how to eat better, how to exercise more, and how to manage medications. So, as you can see, chronic disease plays a really important role on the healthcare system as the population is aging. In the left graph, you can see that a history of stroke and cardiovascular disease and a history of heart attack are all really high in older people. So as the population ages, those are going to become even more relevant. So now that we know this, we can start preparing now by training more doctors to be cardiologists and preparing more people by educating them on how to reduce their risk of cardiovascular disease. In the right graph, you can see also that cardiology is going to increase. So again, we know that we're going to need more cardiologists as the population ages. And also, vascular surgery is a huge spike, and that is also due to the aging population because vascular surgeons perform a lot of surgeries on older people because, for example, like varicose veins is a really big one that is only relevant for an older population. So, although chronic disease is very relevant, there's also a lot of non-chronic health conditions in older adults that lead to a greater use of healthcare services. Excuse me. So, a big one of this is falling. There's an increased risk for falls in older people. And according to the Journal of American Medical Association, every year, around 2.5 million people ages 65 and older are treated due to falls, which is more than any other age group. And unfortunately, 1/3 of the people treated for falling will end up back in the emergency room within a year due to another fall. And the majority of these falls occur at home because there's a lot of slippery surfaces like bathroom floors or rugs. So future healthcare providers should take this into account and encourage older adults to avoid slippery surfaces and rugs. Another non-chronic health condition is influenza, or more commonly known as the flu. This isn't a chronic disease, but it's still among the top 8 leading cause of death in older adults. And seniors are more susceptible to influenza because their immune system doesn't work as well, so they are not able to fight off infections as well. So non-chronic diseases also have a substantial impact on the healthcare system and therefore need to be prepared for by future physicians. So now I want to talk about racial and gender disparities in healthcare needs. So first, disparities in race. A research conducted at the University of Wisconsin demonstrated that there are many race disparities in healthcare of older adults, which are often related to socioeconomic status. So this research, they found that the main reason African American older adults suffer from a higher number of chronic conditions and worse overall health is due to living in socioeconomically disadvantaged communities. And as you can see in this graph, heart disease is a lot higher in African Americans compared to any other group. Also cancer and diabetes too, but especially heart disease. And again, that is due mainly to socioeconomic status. So similarly, there is also a difference in healthcare utilization within gender groups. So as you can see in this graph, older women have more healthcare needs. So it shows in each of these different sections, mobility, stair climbing, upper extremity, these are just different types of healthcare services. It's normally greater in women in almost all of them. But unfortunately, older women have less economic resources to pay for those services. And this was shown through a study conducted through the Health and Retirement Study. So there's a lot of healthcare disparities in the LGBT community, and this is because a large number of lesbian and gay senior citizens find it really challenging to comfortably seek out healthcare services. A survey conducted by the National LGBT Health Education Center in 2006 reported that more than 50% of LGBT baby boomers did not feel comfortable reporting their sexual orientation due to the fear of not being treated with dignity and respect. And due to this disparity in the LGBT community's healthcare services, there are many cases of depression and anxiety within the older population of LGBT community. And a survey of around 400 older adults in the LGBT community in 2006 resulted in 39% of people considering suicide and 12% of people having suicidal thoughts. So fortunately, those studies were done in 2006, and the American Society has been making small improvements toward the awareness and acceptance of all races and genders, but inequality is still a very relevant issue for physicians to remember, especially as the population continues to age. And an important construct for decreasing inequality is working towards reducing cost of healthcare for every member of the older population so that everyone can have equal access to health services. And this leads me into how the aging population will affect healthcare cost. So you can see in this graph that the distribution of healthcare costs increases throughout your lifespan. So healthcare costs is really strongly age dependent. Costs are the lowest for children, then they rise steadily throughout adult life, then they increase exponentially, so they spike up in older age groups. So the cost is high. The cost for all healthcare is highest for older adults. So the most relevant healthcare cost for older adults topic is Medicare. And Medicare is one of the largest health insurance programs in the world. Medicare accounts for more than 17% of the United States health expenditures, which is 1/8 of the total federal budget, which I thought was crazy. The aging population is hypothesized to have a drastic effect on Medicare and healthcare costs for older adults, because the total Medicare spending is expected to rise from $540 billion to $1 trillion by 2024. And as the population ages, people who are going to be using Medicare will rise from 20 million, which was how many there were in 1970, to 80 million in 2030. Due to this radical increase, the Medicare Payment Advisory Commission is working to find a solution to reduce costs for older adults. Although there's no way to entirely counter the cost of treating an aging population, like it's just gonna happen no matter what. There are multiple methods, though, that can help reduce Medicare spending and healthcare costs overall. So the first one is decentralization, and Dr. Guzner describes this as a process of pushing care provision down to the person with the lowest level of education. So it's pretty much the idea that doctors will be giving more responsibility to nurses and nurse practitioners and physician assistants. This will help to spread out the knowledge of healthcare and will ultimately lead to decreasing the cost of healthcare. So this will allow the aging population to have more outlets to go to, more people to see for health services, and doctors will need to rely more on nurse practitioners and physicians' assistants and other lower level healthcare providers. Another part of decentralization that kind of leads into the next point is an increased responsibility for self-care by the patient, and this will really help reduce costs. So if patients place more importance on eating healthy, exercising, avoiding smoking, and other unhealthy habits, they will reduce the amount of need for in-office visits, which will greatly reduce the cost for healthcare. And the last point is to increase the technology use. Use in technology in the older population is expected to increase because many baby boomers actually use technology for their work and like for connecting with family. So they feel comfortable using technology now. So the older population will be able to use technology to look up health information on the internet, ask doctors questions, and also telehealth is a really important strategy that will help reduce costs too. It's pretty much when like a program that allows patients to send their vital signs and health status to their physicians electronically. This will also reduce the amount of in-office visits, so therefore reducing healthcare costs. So although the aging population will increase the overall costs of healthcare, there will be many ways, including decentralization and technology use, that can benefit patients by lowering costs. So that was the body. Now I'm going to wrap it up in the conclusion. So in conclusion, the healthcare system for older adults is very dynamic and is hopefully changing for the better through education and teamwork as the population ages and more people's need for healthcare increases. Older adults have the highest number of physician and hospital visits, and this should really encourage physicians and researchers to explore the best way to serve this population. Similarly, research clearly states that chronic disease, such as heart disease and diabetes, and a chronic disease such as falling and influenza, are the most common ailments of older adults, which should also serve for a call to action to improve medications and treatments. And physicians can prepare for the impact of the aging population on healthcare by teaching procedures and treatments to medical students, nurses, physicians' assistants. There's really no way around the increase of the cost of healthcare due to the aging population. However, through teamwork, self-care, and technology use, older adults will receive the care that they deserve. This is my reference page, so I hope you guys learned something from this presentation. And if you have any questions, please leave them below. And I look forward to seeing your presentation. Thank you.